All right, welcome you guys. I hope we usually don't get a lot of live viewers for our webinars, but we get substantially more traffic after these things go on our webpage. And hopefully you out there are our patients and our families of patients, retirement community staff, and other people who care about people with hearing loss. We're going to go through a few slides today. It's going to be short and sweet. My name is Robert Smith. I'm the president and founder of St. John's Hearing Institute. We're going to talk about brain changes and hearing loss. We're not in the neurology practice. We're in the audiology practice. We treat hearing loss with hearing devices and extensive rehabilitation. Our patients succeed because of the latter part. And just want to put a disclaimer out there that we are not experts in the brain, but because all of the auditory information that we help walk alongside you all with, we want to make sure that it gets to the brain. And so we want to have this discussion today. Thanks for showing up. Whenever you click in and hang out with us, we are being recorded, just another reminder. So I want to reintroduce you, if you've caught our previous webinars, to a man that you've probably seen or read about. If you have a hearing loss or you care about someone with hearing loss, Frank Lynn from Johns Hopkins. And I just really trust this guy. Over the years, he has brought great insight and information to those of us that treat hearing loss. And when he brings something forward, we can trust it. And I hope and pray that you can trust it. So a quick intro on his extensive information is that the brain scans that they have done show us that hearing loss may contribute to a faster rate of atrophy in the brain. So that's shrinkage. We know over time, all of us, as we chronologically enhance, our brain shrinks over time. Our resources may diminish somewhat. I hate to admit that, but it's the way it is. And hopefully, if you're taking notes, by the way, I just want to interrupt myself. If you respond to us at the end, now or later, and you would like to have a copy of our slide deck, Carla, behind that big R, will send you a copy of the slide deck. And these resources are on there. And my job, I feel, is to introduce you. If you really want to know more, I'd encourage you to go deep. Don't believe what I say, as I'm not an expert on the brain, but go and study these authors, because they just put out so much wonderful information that'll help you make sense of hearing loss and the effects that it has on the brain. So we love Johns Hopkins because we love Frank Lynn. And I'm going to introduce you to a video, but here's a piece that we pulled out of the video from an audiology consultant in local Iowa, I believe it is. I'm going to hope and pray that this thing launches, and hope you can see.
Dialpad AI is your magic crystal ball
Obviously,
for
have to put up
sales.
with
It
YouTube
won't
commercials for a
predict
minute.
winning lottery numbers, but it will.
But here we
Midday
go.
Medical interview is sponsored by Concept by Iowa Hearing.
Hearing loss is often accepted as just a part of aging, and people tend to ignore it until later in life. But today, we're going to show you visible evidence that untreated hearing loss is strongly linked to affecting the brain and dementia with Taylor Parker from Concept by Iowa Hearing. We're going to show an MRI comparing brains coming up. But I thought we could touch on how even a mild hearing loss can affect the brain health, and it escalates.
Yeah, so understanding how hearing really works, that our ears just conduct the sound. Our cochlea has 15,000 tiny little hairs or nerves inside of that, that as they get damaged from noise exposure, from, different aspects in our life, diabetes, things like that, that's what carries the signal to the brain, where the brain has to process that. So ears are just conductors. The brain processes that. And when we have an untreated hearing loss, the brain actually has to work harder. It has to compensate. And the first thing it does is it pulls from cognitive. Cognitive then is the link to dementia. So even with a mild untreated hearing loss, so when people come in, we'll test someone and there'll be a mild hearing loss. They'll say, "Oh, I'm good for a while. I'm okay." And it's this thing that we want to put off till later in life. That it's something that they considered an age thing. That as I get older, and everybody has their own definition of what older is, but as I get older, then I will worry about my hearing loss. But with a mild untreated hearing loss, you're twice as likely to develop dementia. And as the hearing loss worsens, it can increase up to 5 times.
Oh.
So 2 to 5 times more likely to develop dementia. And then,
And
as
show
we,
the MRI.
yeah.
Can we get to that?
yeah. So, understanding that is actually the brain. So on the right-hand side, that is normal hearing. On the left-hand side, that's an untreated hearing loss. So that you can see the actual physical change of the brain with that untreated hearing loss. The issue there is that that day you decide, okay, I'm old enough now that I'm going to treat my hearing loss, your brain doesn't revert back to the right-hand side.
Right.
It doesn't regrow.
Mhm.
Now, by treating your hearing loss, you can reduce dementia symptoms by up to 75% and improve cognitive decline by up to 50%. So wearing hearing devices can improve on the brain, but it will never reshape the brain back to its original form. So understanding that it's very critical that we treat hearing loss when it happens, not that we put it off till later in life because of what happens with the cognitive portion. And
Right.
cognition's how we function every day. It's how we communicate. It's how we think about, how we process information. There's so much that goes into the cognitive that, understanding that waiting is harming your brain.
Well, it's quality of life.
Yes.
And a way to start treatment is to get a free screening.
That's right. So
Okay, so we're gonna exit this video. I just think this man did a great job of explaining things clearly. And again, here's one of the scans that he used, and one that one of my favorite authors is going to also use. I'm going to pop over to the next slide. Here's another person that if you really like to research hearing loss and how it affects the brain, how it affects our daily function, I'd highly suggest you search diligently the Anu Sharma. She's from the University of Colorado Boulder. And one of the things that she did, and some of the amazing papers they're writing out of there with physical evidence about how these brain changes can happen. Here's a couple of shots demonstrating on the left-hand side. This is someone who, the hearing section of the brain and the function of the brain, and before they get hearing devices. And the brain starts to deorganize, it starts to get robbed from, if you will, the sections of the brain that aren't being used because of the hearing loss are being taken over by other functions, usually vision and other high functions of the brain. The one on the right side, remarkable, is someone who has had intervention for 6 months, had properly fit hearing devices. And again, when research comes out, these are folks who didn't go down to Walmart and buy a couple of hearing aids or amplifiers off of online, but people who were professionally treated, followed up with, that all the right disciplines, if you will, were engaged to be able to help this person get back reconnected and function in life. But after just 6 months, that portion of the brain that hears starts to reorganize again, and kind of blows you away when you see that what we do or don't do about our hearing health, it's obviously all part of our overall health. It really matters. And so I want to, again, this is just an introduction. I hope I whet your thirst so you go deeper. Don't believe what I say, but go into these authors and the places that are following all of thousands and thousands of patients and finding out how hearing loss does affect the cognitive function. But every day over the last 40 years, I've seen cognitive change in people with hearing loss, both from other sources as well as influence from letting a hearing loss go. But we look, this is a great example on the left of a guy who isn't hearing, and the actual physical strain, not only on the brain, but on the body, because he's trying to do everything he can to hear. And then you look at the person on the right and you see a relaxed brain, a relaxed person, And that's what we have the privilege of seeing every day out there as we help and treat you. And those of you that have family members, and especially as you've seen them where we found them with hearing loss untreated versus 6 months down the road, it's crazy the difference in this person. You'll see this person on the left that we find, and typically we specialize in the 80 to 107-year-old crowd. And typically we our practice serves the probably 43 to 45 retirement communities out there in the Tampa Bay area. So we find this person, and typically they seem to be stressed. Their body language is very clear that they're not hearing. Their whole body is in a stress to take in information from their community that they live in. And so often they will just back off from life. Little by little, day by day, month by month, year by year, they quit. And those of you that have family members, people you love, you notice that, but it happens over time, and they just kind of wake up one day and like, wow, this is really bad. And what's so cool is that when we get done with a patient that is treatable because they haven't waited too long, we notice a calmer person. We notice a confident look on their face. They seem connected, and they're confident in their abilities to communicate. They no longer have to hide from the conversation because they are afraid or embarrassed that they might answer wrong. And they're more competent. They make better decisions because they can take in information and use it and store it and remember more of it. And so we'll judge that person, right or wrong, as incompetent when we see the signs of hearing loss in their life, on their face, in their behavior. And we'll see a higher level of competence, a higher level of cognitive function and interaction with the community around them, with their providers, when they go to the doctor, with their family members. They'll get back in the game, so to speak. So again, what we do matters. And I would, something my grandmother taught me years ago, I might have said it on an earlier webinar, but you remember the old saying, use it or lose it. It all matters. All of our body parts are connected to the brain. We need to take care of ourselves. And I would encourage those of you out there that are sitting on the fence, whether it's with our practice or another practice, or if you're across the nation, please seek help from someone that you trust. Find out what's going on, find out what your interventions might be. I want to throw something at you. A great friend the other day told me in passing he wasn't hearing well in one ear, and I've known this guy for years. And so I made him get together with me, and we tested his hearing, and one of his ears had a medical type of middle ear loss, and intervention from the local ENT was the intervention that he actually needed. And it's simple and it's easy. He got steroids, antibiotics, and the ear is clearing and coming back. But what if you just let those things go? And as sound doesn't travel properly through that ear, through that inner ear, the cochlea, and then that information doesn't get to the brain over time, the brain starts to, I'm just going to use plain English, and that is disorganize, and resources get robbed and reassigned. And so when this man went through his intervention, he's going to gain that stimulation back, so that other side of the brain is not going to get denied any longer. But use it or lose it really applies, guys. So what we're going to do is we're going to take questions now. And I want to encourage you, if you have a question for us, even if you don't live in the Tampa Bay area, even if you're not going to choose us as your providers of choice, you're welcome to call that number on the screen. You're welcome to shoot an email to our person who's on the other end of that email. address and ask a question. We're happy to point you in any direction that we can. But I want to encourage those of you out there who have somebody that you love. If you, I know you get the stiff arm, I'm okay, or not yet, or leave me alone, or whatever it is, but lean into them. Find a way to encourage them just to get it checked out. Don't assume that it's always hearing devices, hearing aids that a person may need. There are medical intervention steps for certain types of hearing loss, quick fixes that can be taken care of with the right drugs, or maybe some type of a medical intervention from an ear, nose, and throat specialist. The majority of people that do have long-term hearing loss will require hearing devices. And please don't order hearing aids off of the internet and get linked up with a provider that you may not like, that you may be sorry for. Be careful about your insurances guiding and leading, and those insurances that dictate who you can and cannot go to. There are very few insurances that actually provide a substantial benefit for hearing devices and rehab. And so get 2 or 3 opinions, follow the person's advice that you have the best feeling and hear about, that you trust. And we hope to get to talk to you, but even if not, we hope and pray for a fantastic outcome for you. So we are going to go ahead and get to the questions now. And we also want to thank those of you who are not going to stick around, or those of you who are tuning in later. We want to thank you for watching these webinars. I hope they're helpful. Please send us an email if you like them, if you hate them. And we hope to see you soon. Thank you so much, and have a blessed day. Bye-bye.